Potassium is a essential mineral that is strange because it's rather easy to get in the diet. It's found in a lot of foods, and yet, despite this, many people don't get enough potassium. In fact, they say that 98%, according to studies, 98% of all adults in the United States are not meeting the daily intake requirements. The requirements for potassium are between 3,500 and 4,700 milligrams a day. But foods that are high in potassium include tomatoes, spinach, sweet potatoes, most fruits and vegetables. Now, the thing about potassium is that it's what they call an essential electrolyte. It's involved in nerve conduction. It's involved in muscle contraction. It's involved in body heat regulation. It's involved in glycogen replenishment in muscle, which is very important for anybody involved in bodybuilding or athletics. Now, there's a couple of practices that bodybuilders in particular do that can directly affect their potassium levels, which could be very dangerous. But as I said, potassium, it's an essential mineral, and it's an electrolyte. It's also found besides the foods I mentioned, it's found in fish. Salmon contains it. 98% of the potassium is in your cells, and 80% of it is found inside the skeletal muscle, while 20% is in bone, red blood cells, and liver. Now, there's what they call a sodium-potassium pump in cells that basically what happens is it kind of pumps out potassium and pumps in sodium, and there's a constant back and forth between sodium and potassium. They're kind of like a yin and yang of minerals. A little known fact about potassium, which is very useful for those of you who compete in bodybuilding or who are going to do maybe a photo shoot or something, want to look really muscular and hard. If you overeat, let's say for some reason you overeat sodium, taking a little bit too much sodium. Sodium is very easy to get. Almost every processed food contains sodium, and it's found in many natural foods. And sometimes, especially if you eat processed foods or these snacks like chips and stuff, they're just loaded with sodium, but they have almost no potassium. But there's a little trick. If you take in a 50% proportion of potassium to sodium, for example, let's say you take in 3,000 milligrams of sodium, which is a pretty decent dose. If you also follow that by ingesting 1,500 milligrams of potassium, the potassium will push most of the sodium out of the body. In other words, it's like those science fiction movies where two beings cannot exist in the same universe. Well, potassium, sodium can, but potassium tends to cause sodium to be rapidly excreted. By doing so, you will reduce water retention tremendously, and you'll also, help maintain blood pressure too, because there are a certain number of people, for some reason, particularly black people, are prone to what they call sodium-based hypertension or high blood pressure. In other words, they're very sensitive to sodium, and when they eat a lot of sodium, they tend to get hypertension or blood pressure, which is a very, very high risk factor for cardiovascular disease, especially stroke. As I said, potassium is very important for muscle contractions, heart function, and maintaining fluid balance. An interesting thing about potassium is too little and too much of potassium are both very bad. Again, if you get too little potassium, you get things like muscle cramps. You don't recover properly from workouts. You can even get high blood pressure. But too much potassium can adversely affect the heart. Can cause, in fact, if you got the death penalty, and they were going to put you to death, it involves a number of infusions. The first two are to relax you. And then the one that actually kills you is an injection of potassium directly in the heart, large amount of potassium. If you inject a large amount of potassium directly in the heart, it's just like a bullet. The heart stops. The heart immediately stops. And you know what happens when that happens. When you take in a lot of potassium, it lowers the risk for not only high blood pressure, but also kidney stones and osteoporosis. There's a supplemental form of potassium. I always keep a bottle of this around myself. It's called potassium citrate. That's one of the preferred forms because the government doesn't allow, if you take potassium in tablets, the government doesn't allow more than 99 milligrams of potassium in each tablet. So you'd have to take a lot of tablets to get a decent amount of potassium, at least 10 of them at a time. The problem with oral potassium is twofold. The first thing is that concentrated potassium, including drug forms of potassium, tend to be very irritating to the gastrointestinal lining. They can cause a lot of pain, a lot of gastrointestinal upset. And the second thing, and a lot of people don't know this, particularly bodybuilders, is that when you take isolated potassium away from a meal, certain mechanisms go into effect in your body. Specifically, that your body detects a large intake of isolated potassium. The adrenal glands will then secrete a steroid hormone called aldosterone. What aldosterone does, the main function of aldosterone is to maintain blood volume. So what happens is when a large amount of oral potassium is taken by itself, let's say a supplemental form, you get a huge secretion of aldosterone. The aldosterone will cause the elimination of potassium, but it also greatly retains sodium. So you wind up actually can get bloated. You can actually have water retention if you take isolated potassium. And a lot of bodybuilders who, let's say, take diuretic drugs or something, they heard that you lose electrolytes like potassium and sodium and magnesium, so they take supplemental potassium. But it's not a good idea to take isolated potassium supplements. Now, potassium found naturally in food does not stimulate aldosterone. Potassium taken with a meal, even a supplemental potassium, does not stimulate aldosterone. Now, I keep the potassium citrate around. The potassium citrate form actually has been shown to prevent kidney stones. Now, kidney stones have a genetic component. No one in my family has had kidney stones, but the potassium citrate powder seems to be a little bit easier on the body. It doesn't cause any gastro upset. I use it mainly when I eat a little bit too much sodium. For example, when I eat chicken and rice, to me that's like eating cardboard because I eat a skinless chicken breast with let's say a cup of rice, and to me it's like eating cardboard. It has no taste. I know people say, well, put this on or put that on. I've tried all these flavor enhancers, and chicken tastes terrible to me. What I found works is when I eat chicken and rice, I put a little bit of low-sodium soy sauce on it. And that makes the chicken and rice taste very good to me. The only problem with that is that the low-sodium soy sauce, even if you only use maybe 2 tablespoons, still is a little bit too much sodium to take in at once. So what I do is when I do that, I take my potassium citrate powder and I take about, half a teaspoon, which will give me about 2 grams of elemental potassium. Boom. So the sodium problem is eliminated instantly. In other words, it's as if I had the best of both worlds. I got the increased taste benefit of the sodium soy sauce, but I also, by taking the potassium citrate, I eliminated the sodium problem, so you don't get any water retention or anything. This is a little trick that's known. And also, while we're on the subject of bodybuilders and athletes, a lot of bodybuilders will use certain diuretics. They're called potassium-sparing diuretics. And as the name implies, these particular, give an example, aldactone is one of them. When you take aldactone, your body will spare potassium, and it prevents the kidneys from excreting. You see, normally the kidneys, if you take in a large amount of potassium, the organ that excretes it is the kidneys. It immediately throws the potassium out of the body. But when you take a potassium-sparing diuretic, it prevents the kidneys from excreting the potassium rapidly, so you wind up retaining a lot more potassium than you normally would. Now, if you take a lot of potassium with a potassium-sparing diuretic, you can get to the point where you have hyperkalemia, it's called, which is an excessive amount of potassium, and that can cause heart rhythm disturbances. It actually happened to one bodybuilder who I knew. Some of you who've been around for a couple of years might remember this guy. He was a professional bodybuilder. Unfortunately, he died at age 48 from heart disease. But at this particular time, he was still competing. He was in great shape. This was at the Arnold contest in Columbus, Ohio. And I wrote, they used to have a little bus that would take you from the hotel to the contest venue, which was I don't know what it is now, but at that time, it was called the Veterans Memorial Auditorium. And I got on the bus, and the only other person on the bus was Mike Matarazzo, who I knew very well. I had written a couple of articles about him, and I kind of like was friendly with him. We were both from back east, and we were kind of friends. And I said, Mike, how you doing? How do you feel? He says, Jerry, I feel like I'm going to die. I said, what's the matter? Well, to make a long story short, Mike took a potassium-sparing diuretic, and because it was a diuretic, he didn't know that taking a potassium-sparing diuretic would retain potassium, and he took a supplemental dose of potassium with the potassium-sparing diuretic. He didn't die, but he felt very sick, and he almost had to go to the emergency room. So this is an example of what can happen if you combine a potassium-sparing diuretic with supplemental potassium. You don't do that. Now, other diuretics, for example, what's the other one? The most popular one, I can't remember. Well, the ones that are not potassium-sparing diuretics, you do need potassium. You do need to supplement potassium because they cause a huge, massive loss of electrolytes: potassium, calcium, magnesium, and sodium. So if you're taking, let's say, Lasix was the one I was trying to remember. If you take Lasix, it is a good idea to take some supplemental potassium, but take it with food. Don't take it alone, again, because of the aldosterone effect. Most adults, despite the fact that potassium is found in a fairly large variety of foods, they don't eat enough potassium because a lot of people eat mostly processed foods. Processed foods are very poor sources of potassium, but they're loaded with sodium. Now remember, if you're taking a lot of sodium and you don't take in let's say at least 50% as much potassium, the sodium is going to push potassium out of the body. It works in reverse too. So that can cause a problem with low potassium levels. But they don't actually get outright deficient. Despite not eating enough potassium in foods, potassium deficiency is very rare. It's known medically as hypokalemia. And you have to have a blood level less potassium, less than 3.6 millimoles per liter, and that's usually very rare for that to happen. So for some reason, I guess it's because it's such an important mineral. Even if you're not getting enough potassium, the body will try and hold on to as much as possible. That's probably why a potassium deficiency is rare. But most people still are not getting enough potassium to have health effects like helping to prevent blood pressure and cardiovascular benefits. You can rapidly lose potassium under certain conditions, such as if you have a chronic diarrhea. That can lead to a tremendous loss of potassium. So can vomiting. If you have diarrhea and vomiting, you're going to be losing a lot of potassium. And as I mentioned, if you take diuretics, tremendous loss of potassium. Now, if you have a deficiency, a mild deficiency of potassium, you're not going to feel much. If you have a moderate deficiency, you're going to get the symptoms you'll get are muscle cramps, muscle pain, weakness, and discomfort. If you have a severe deficiency, then you're going to go into irregular heartbeat or arrhythmias and even possible muscle paralysis because potassium is needed for muscle contraction. As I said, if you want to get your potassium from food, the best sources is by far fruits and vegetables. This is the reason why diets that are high in fruits and vegetables, usually one of the reasons why diets that emphasize fruits and vegetables like the Mediterranean diet, one of the reasons why it's so cardioprotective is because it's very rich in potassium and magnesium, which are very heart protective minerals. Now, the government, I'm not sure of this, but I think I recently read that even though the government recommends at least up to 4,750 milligrams of potassium, so few people eat that much potassium that they lowered the requirement. I think it's down to 2,500, but that's not enough. It's not enough because of the ubiquitousness of sodium. There's so much sodium everywhere in natural foods and in processed foods and in snack. It's all over the place. 2,500 milligrams is not enough potassium for health. That is a big mistake. Now, just to give you an idea, ancient man, their diet, somebody was able to figure out that, what do they call that? I forgot the word for it, the Paleolithic man, so to speak. The Paleolithic diet, the original diet used by Paleolithic men and women, they consumed an average of 11,000 milligrams a day of potassium. So it shows you that the body basically evolved to expect a lot of potassium. So here's a couple of foods, so you have an idea. These foods. I'm talking about a 100 gram or 3.5 ounce serving. Tomato products such as canned tomatoes, tomato paste, a 100 gram serving or 3.5 ounces has 1,014 milligrams of potassium. Cooked beet greens have 990 milligrams. Baked yams, 670 milligrams. Russet potatoes baked in the skin. Baked potatoes have a reputation of being high in potassium, which is true, but they're not the highest in potassium, but they do have a good amount of potassium, especially if you eat the skin. Russet baked potato in the skin has 550 milligrams. Raw spinach has 550 milligrams, again, for 3.5 ounces. Avocado has 485 milligrams. Baked sweet potato, 475. Atlantic cooked salmon, 384. And a banana, which is another food that has a reputation of being high in potassium. Banana has 358 milligrams, which is not super high, but not bad. That's pretty good. So, again, the health benefits of potassium, again, it helps. Its tremendous effect on lowering blood pressure. There's a couple of medical experts who study hypertension have actually published articles where they end up potassium, meaning close to 5 grams a day, that most cases of what they call elemental hypertension, meaning high blood pressure from no direct known cause, this type of blood pressure would be completely controlled if they consumed 5 grams of potassium a day. I mean, it would be disappear. And that would mean a huge lowering of strokes and heart attacks. So salt sensitivity, people with this condition, if you're sensitive to sodium, as I said earlier, they experience a 10% increase in blood pressure after eating salt. And that 10% could mean the difference of having a stroke and not having a stroke. But if you take in potassium, as I said, it'll modify the effect, so it basically neutralizes the effect of potassium, even in people with salt sensitivity. Consuming potassium is known to reduce the risk of stroke by an average of 27%. Higher potassium intake will help prevent the bone thinning disease osteoporosis, and also potassium will also help prevent kidney stones. The best supplemental form for that is potassium citrate, as I mentioned earlier. If you have a genetic tendency, somebody in your family has kidney stones, or if you know that you have a tendency to kidney stones, you want to take in 3 supplements. One of them is potassium citrate. Take it with food. The other 2 are magnesium and B6. Magnesium and B6 prevent kidney stones are formed usually when a substance called calcium oxalate hardens and becomes a stone. Now, what magnesium and B6 does is it prevents the precipitation of calcium with oxalate. In other words, it keeps them more or less liquid so they don't form into stones. And the potassium citrate helps in that regard too. People that have a high potassium diet, even with a genetic tendency towards kidney stones, have much, much lower rates of kidney stones. Again, most health organizations around the world suggest at least 3,500 milligrams, but other countries, the U.S. recommends 4,700. But some people say that consuming more than 4,700 milligrams it doesn't impart any extra health benefits. I disagree. Based on the research I've seen over the years on potassium, I think especially you got to go by how much sodium you eat. The more sodium you consume, the greater your intake of potassium should be. If you don't consume a lot of sodium, then 4,700 is a good amount of potassium to eat a day. So potassium is very, very important for anyone involved in sports or athletics, because you can lose potassium through sweat. If you sweat a lot, you will lose potassium. Again, black people, because of the sensitivity to sodium, they should be taking in 4,700 milligrams a day of potassium. Anyone who's at risk of high blood pressure, kidney stones, osteoporosis, or stroke should take 4,000 milligrams a day. So I think that's about it for potassium. I think I more or less covered the waterfront, so to speak, with potassium. Very, very important. As I said, I keep a bottle of, I don't use tablets because, again, the government maximizes each dose of the tablet at 99 because they're afraid of, for some reason, the government thinks that if a supplement of potassium provided more than 99 milligrams per pill, that it would people would consume too much and wind up with too much potassium in the body, which can cause heart problems. But, you know, you'd have to take, for 40 or 50 of those tablets before you begin to have elevated, super high potassium levels. So it was a ridiculous move on the part of the government, among many other ridiculous moves. But I don't bother with the tablets because they're a little bit caustic. As I said, they can irritate the intestine or the gastrointestinal lining. I always use potassium powder. It's not expensive. I get a bottle. It costs me probably about $6. It lasts for months because I only use about, half a teaspoon when I use it. And I only use it when I eat a meal that contains an abnormal amount of sodium. Like, for example, when I use the low sodium soy sauce. It's the only time I take the potassium. I never take it by itself. As I said, you don't want to take supplemental potassium by itself. So that's about it. Very important mineral. So if you want more information on nutrition, exercise science, anti-aging research you can use today, effective fat loss techniques, ergogenic aids, hormonal therapy, supplement science, which supplements work, which ones don't. I'm one of the rare, and I'll say a third time, rare people who do YouTube videos that is not associated with a supplement company. Those of you who look at frequent health-based YouTube videos, you'll notice the recent trend where somebody will be talking about a topic, and right in the middle of the video, they'll say, you can get new age supplements at 10% discount if you use the code AZ423, whatever it is. And some of them even list a bunch of supplements in the comments section, all from the single company, that they claim they use. These are shills. These are people that are being paid by the supplement companies to push their supplements in their videos. They're shills. I'm not saying that the information they're presenting is wrong. What I'm saying is they're paid to push those supplements. You will not see me pushing any commercial supplement either in my videos or my Applied Metabolics publication. I don't do that. I'm not associated, so I can give you the 100% honest truth. If a supplement's garbage, I'm going to tell you it's garbage. I don't care who gets mad, because somebody who's selling garbage needs to be exposed, and I think you'll agree with that. Most rational people would agree with that. So I also cover women's health and fitness. I cover more topics in Applied Metabolics than any other digital publication. And besides that, to my knowledge, nobody can match my over 60 years of experience, both in the gym and studying on my own and practical experience. It cannot be matched. And all of this is incorporated in my Applied Metabolics. And no matter what your level of education or experience, I absolutely guarantee you will learn something by reading in each issue of Applied Metabolics. After reading it, other people have said this in podcasts, but I'll say it also. After reading Applied Metabolics for at least 7-8 months, you yourself will be an expert on nutrition and exercise because you're going to know the truth. It'll save you a lot of money because you'll know what's true and what's bullshit. It'll separate the old cliche, the wheat from the chaff. You'll know what the truth is by reading Applied Metabolics. Because one of the reasons I started it over 8 years ago was I was sick of all the crap and nonsense that were in bodybuilding magazines, which I was writing for at the time, and also on the internet. And it's only gotten worse. But the bodybuilding magazines are practically just about dead. But the nonsense and the lies and the bullshit continue on the internet, and a lot of these YouTube videos, with 90% of them are absolute bullshit. And I'm not just talking about the ones that are commercially oriented. Some of the other ones, they're just incredibly bad information. So Applied Metabolics is your antidote to the crap that you're inundated with on the internet. So subscribe today. It's www.appliedmetabolics.com. When you subscribe, send me an email. I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on exercise, nutrition science, and various other medical topics. I also have an email portal on my Applied Metabolics website, where current subscribers only, I don't accept unsolicited questions. Current subscribers only can send me short questions about anything they might have read in Applied Metabolics or any other question related to nutrition, exercise, and I will try to answer them. But because of time restraints and other reasons, including the fact that I answer questions from subscribers because I appreciate their subscription, it's kind of a bonus for subscribing. So obviously you're going to have to be a subscriber. However, you're welcome to leave comments under the videos, suggestions. I'm open to suggestions for future video topics, as long as I feel a little interest, a large number of people. I don't do crazy stuff, about, urine drinking and that kind of crap. I'm not going to deal with that stuff. I mean, you're gonna have to go to one of the other knuckleheads on YouTube that deals with it. I'm not going to start talking about the properties of trenbolone and all this kind of garbage, because I'm not going to go into it. Let's put it that way. I do talk about various anabolic drugs in Applied Metabolics, but everything I talk about is based on science, not the anecdotal garbage that's on the internet, such as, this is the drug stat that will make you Mr. Olympia. Yeah, right. Okay. It's based on absolutely nothing. Also, a sad note, I just want to point out, some of you who've subscribed to this channel for a while have seen some of my videos, and I sometimes bring my friend Bruno, my little dog Bruno, into the video. Sometimes he's not in the video, but he's barking in the background. I had that dog was 23 years old. I had him for 20 years. On March 12th, 2023, he passed away. What happened? Bruno, as he got older, his health, he had severe arthritis in his legs and his spine. I gave him medication, able to walk. But what happened was he contracted a kidney disease, and his kidneys basically was starting to fail. He was in what they call stage 3 kidney failure. He also had a gastrointestinal problem. I was treating him for both. I was giving him IV fluids. But, his body, probably because of his age, his little body couldn't take it. He kept losing weight. I knew he was dying because I've had other animals, and this is for all of you that have animals, no matter what the animal is. Let me give you a tip. When animals stop eating and drinking, they're dying. They're going to be dead very soon, within a week. I've seen it happen many times. Bruno stopped eating 4 days before his death. I knew he was going to go. I did everything I could, but it was to no avail. He was dying. The last 2 days, he refused to eat. Well, he wasn't eating any solid food. I was trying to squirt baby food in his mouth and give him fluids, but the last day, he wouldn't even take that. I brought him to the vet. She told me he had a heart rhythm disturbance. She said, do you want me to give him the needle now? I couldn't do it. I've never had to put down an animal. They've all died on their own, and I couldn't do it with Bruno. I wanted him to go on his own terms. Believe me, if he was suffering, if he was in pain, yes, I would have had them, give him the needle, put him to sleep. But there was no overt signs. The only time I saw him in pain was the actual minute that he died. I was sitting right where I'm sitting now, and I heard a noise. I looked over, convulsion. I ran up to him. I started rubbing his back and his face and trying to calm him down. I could see he was in severe agony. I believe now in retrospect that he had a massive heart attack. What happened was he turned his little head to me. He was blind and deaf, but he still kind of looked at me. And he just, with his head in my hands, he died. And I'll always miss that little guy. So I just wanted to let you guys know. Some of you guys were kind of fans of Bruno. I'll always miss him. He was my best friend. And I'll probably get another dog. I don't know when, but if you want to have the best friend, trust me, go to your local shelter and adopt a dog. Thank you for listening.